being here this morning to join us in our big announcement. This is a historic day for Lake Regional Health System. I feel like I should cue a drum roll because today we're proud to announce that Lake Regional Health System is the newest member to the Mayo Clinic Care Network. Through this relationship, we work closely with one of the most recognized and respected health systems in the world, the Mayo Clinic. Joining me today are our board members, thank you, our physicians and employees, thank you all, our state legislators and leaders, our volunteers, and our Mayo Clinic family, new members of our family, along with Dr. Larson, the medical director of Mayo Clinic Care Network. Lake Regional is one of the select group of hospitals and organizations worldwide to be invited. I want to say that again, to be invited to be part of the Mayo Clinic Care Network. This is one of the most clinically meaningful steps we've taken towards providing highest quality care in our history. Our community deserves world-class health care. So we ask ourselves, why not here? Why not here at Lake of the Ozarks? Why not Lake Regional? Why not provide the best care right here? To achieve this goal, we embarked on a quality journey several years ago. Our team came together and we worked tirelessly to put forth the effort to reach some significant milestones. They built an incredibly talented medical staff. We have support, and together we've transformed the care that we deliver for our patients here in this community. This collaboration with Mayo Clinic marks the beginning of a new era in healthcare for our region. We're not just enhancing the care provided today, but we're building a stronger, more connected health system for the future. At Lake Regional, our culture says we decide what's possible together. Today is about transforming what's possible for the people that we serve now and for future generations. Now please let me welcome our Chief Nursing Officer and Chief Operating Officer, Liz Arner, to the podium.
Thank you, Kevin, for your leadership and for your vision. I am so honored to be here today to celebrate this important opportunity to advance medical care here in our community. Lake Regional's medical staff and leadership are dedicated to our mission to provide exceptional health care to our community. Many of us have deep roots here. Some even grew up here and returned home to practice and to give back to the community we call home. Mayo Clinic has a stellar reputation, the results of over 150 years of commitment to patient-centered care. Here at Lake Regional, we began to explore the potential collaboration through campus visits and dozens of meetings, and it became very clear to us that this was in everyone's best interest and could help accelerate Lake Regional's journey to be the region's best hospital. Together, we will offer access to world-class expertise and the best care right here at home at Lake Regional. Thank you to our board of directors, our medical staff, and everyone working alongside of them. Your dedicated commitment to putting the patient at the center of all we do is why we're here today. Now it's my pleasure to welcome Lake Regional Health System Board Chair, Jason Hewlett.
Thank you, Melissa. As chair, I can tell you, Lake Regional's Board of Directors is excited about this collaboration, not only for our organization, but for our community. The board continues to focus on keeping the mission of Lake Regional intact, to be an independent nonprofit built to serve this unique community. We will continue our quality journey and continue to improve lives by providing exceptional health care. This relationship with Mayo Clinic is certainly in line with that mission. By providing additional solutions and services, we can amplify the care we provide to our patients and continue to make a real difference in mid-Missouri and beyond. Let me also say how proud we are to be a member of the Mayo Clinic Care Network. As you've heard, being a part of this network means we will have access to Mayo Clinic's latest research and treatment recommendations, keeping Lake Regional on the forefront of healthcare. This collaboration is only the beginning. To tell us more about what's to come, I'd like to welcome Mayo Clinic Care Network Medical Director, Dr. Mark Larson.
Thank you, Jason and Melissa and Kevin, and thank you very much for the warm welcome. We arrived yesterday, it was 97. It was really warm. But you live in a really beautiful area. This is a gorgeous place, and you have a wonderful hospital and community. And it's really our honor and our privilege to be here to celebrate this announcement. This is the start of something really special, we feel. And I want to share with you just 3 things. A little bit about the Mayo Clinic, why regional health, and probably most importantly, what does this mean for your providers, for your patients, and for your community? So a little bit about the Mayo Clinic. We've been around, as Melissa said, for about 150 some years. And we had really humble beginnings back in southeast Minnesota. There was a country doctor named W.W. Mayo who would travel in a horse and buggy to go to people's homes, to their farms, to deliver a baby, do an operation on the kitchen table, whatever had to be done. And he often traveled with his 2 young sons, Will and Charlie Mayo, the Mayo brothers. And he would tell his sons, who would say, why do we have to go out in a blizzard and deliver a baby? Why can't they come to us? And W. Mayo would say, the needs of the patient come first. And that is the primary value of the Mayo Clinic for the last 150 years. If you ask any employee at Mayo, what's our primary value? It's the needs of the patient come first. And that's really a founding principle of what this relationship is all about. Fast forward just a little bit. 1910, Will Mayo, one of his sons, was giving a commencement address at Rush University at their medical school. And they asked him to describe the state of medicine. What's medicine all about in 1910? So think of that, about 115 years ago. And he said, you know, medicine is really complex. It's really complicated. One doctor or one team of doctors can't do it all. We need to work together. We need a union of forces because medicine is so complex. And so because of that theme, working together, a union of forces, that's how Mayo Clinic was built. We put specialists all together in one building so that when a patient came, they could get all the care they needed. They could see the specialist, the surgeon, whatever they needed in one building, the first multidisciplinary clinic on the planet. And that became the standard of care. So that idea of working together, a union of forces, collaboration, just what Kevin and Jason and Melissa were talking about, that's what this relationship is about. It's about working together to offer the best care that patients need. Over the last more than 100 years, Mayo Clinic physicians have traveled the globe to learn from physicians, from providers, from high-quality healthcare institutions to learn how do they do it. What are best practices, how to treat patients, do better operations. And they've also shared what they knew, how to take care of patients. So this bi-directional collaboration has been part of our culture, our history for a long time. And that's literally what spawned the birth of the Mayo Clinic Care Network in 2011. The idea that we could share knowledge with providers wherever they may be so that they could care for patients the best that they could in their environment. And that's what we hope will happen right here through this collaboration at Lake Regional. Well, why Lake Regional? Well, as Kevin said, you were chosen because of your excellence, because of your dedication to patient care. We've actually been on a journey with you the last couple of years, part of your clinical quality improvement journey. And we've watched how that has taken place and how that has grown and ascended you to new heights, be recognized by external forces to say this is a high quality institution. We really appreciated that about your staff and your team and your commitment to excellence. And you too put the patient first at the center of everything you do. So truly, your values, your culture really aligns with that of the Mayo Clinic. We appreciate that, we respect that, and that was a large part why Mayo Clinic invited Lake Regional to become a member of this network. And now again, most importantly, what does this mean for your patients and your staff? Well, your providers are great providers, excellent physicians, nurses, administrators. They take great care of patients. But my comment earlier about this union of forces, they now have a union of forces working with them. So if they have a complicated cancer patient, a patient with a type of surgery that might be difficult to perform, they can turn to someone at the Mayo Clinic and say, what would you do? What advice would you give? What treatment option would you consider for this patient if they were in your office? So we can collaborate, work together, some of that electronically, to share consultations back and forth. If you have imaging and pathology, the clinical story, the physicians can work together to come up with a treatment plan for that patient right here. And what does that mean for that patient here? Well, that means they can get an opinion from their provider who knows their unique family situation, their background, their family needs and concerns. They know them best. They know their unique situation. But they can collaborate with Mayo Clinic experts and then together come up with a treatment plan that offers that patient exactly what they need. And that patient doesn't have to travel, can stay closer to home, supported by friends and family, and really importantly, at no cost to the patient. So we think that's just a tremendous benefit of this collaboration, is patients get what they need right here, closer to home, and again, at no cost to patients. So we are really looking forward to celebrating this announcement with you and continuing to collaborate and work with you to care for patients wherever they may be, but most importantly, right here. So with that, I'm going to ask Jason to come back up, along with Melissa and Kevin, and on behalf of the Mayo Clinic, it's my great privilege to welcome Lake Regional Health System to the Mayo Clinic Care Network. Thank you.
Thank you, Dr. Larson. We appreciate your support on this special day. Now, please join me again in celebrating the official announcement that Lake Regional has joined the Mayo Clinic Care Network. And if I could direct your attention. Thank you again for coming, everybody, on this special day. We will accommodate any requests from news media. Jennifer, I believe, is here. She will be our point of contact. Again, thank you for being here. This concludes our program.
They want to